Hi, I'm Sarah, certified professional midwife and founder of Heaven Sent Homebirth, and today I'm going to show you what's inside my midwife bag, which should really be called what's inside my Suburban, because I swear there is a complete clinic in here. I have my vitals bag right here. I have major resuscitation gear in here, as well as some emergency supplies and my med bag. Back here, you're going to find a submersible pump, some germicide wipes, and an extra hose. With a tub liner, and back there, I don't know if you can really see, but that is a lab box that I can take in if I have to do any blood work. Not shown way up there is actually a full-on IV pole. So as you can see, I can fit a lot into my Suburban. So the first thing I'll show you is my vitals bag. And I call it my vitals bag because really it's the bag that contains everything that we use to do vital taking. So we have a baby scale here. We actually use one of these to weigh a baby. Yes, it looks exactly like a big old fish scale. I also have things to check a baby's blood sugar or mom's blood sugar. This is actually a hemoglobin tester, so I can check a mom's iron. This is a newborn pulse ox. But I also have normal stuff like a Doppler. I'm particularly fond of my Doppler because it is waterproof. And then I have just normal things like a blood pressure cuff, some urine strips, all of the things that you would typically need during any like prenatal visit, postpartum visit, or some newborn care assessment. This is actually a special stethoscope called an echo stethoscope, and I have one for this, and I also have an echo add-on to a fetal stethoscope. That one is charging right now, but it can actually help us assess a baby's heart rate and rule out heart murmurs, which is pretty darn cool. And we usually have clients buy something called a birth kit that has a lot of the sterile disposables in it, but of course we do have some sterile disposables if I need those, so that's just like gloves and gauze and things. And then this is my med bag. This is just a little Hopkins bag. In here I have all of my sterilized equipment like scissors and hemostats. In this compartment I have a little sharps container. And here I have some of the herbs that I commonly use. So for people that maybe want to take a more holistic approach to some heavier bleeding, but we're not talking about a hemorrhage, I do have a few products that I commonly use. Which is Hemhalt, Flow Stopper, or I'll use Angelica to help a placenta that is just taking its sweet time. In this main part is where I keep IV fluids and some extra bottles of medication down there. And on the other side of my bag, I actually have these nice lists. This is actually a medication list. So this helps even if we are, sleep deprived and we're using a medication and we're not sure, or maybe we don't remember what some of the contraindications are or how much the dosage, then we have these lists. And on this side of the bag is all of my IV stuff. And then this guy is really the star of the show. This is a softball bag, but it is my big emergency kit. In this top portion here is a canister of medical grade air and oxygen, all of the tubing and everything that goes with it. A handheld bag and mask that we use for resuscitation, eye gel, which is what we would use at home for intubation, extra bulb syringes, and in this pocket we have some Delees. These are good for suctioning. We have some water birth mirrors so that way we can see a baby coming out. We have a heating pad and a cutting board. And this is what we turn into our resuscitation station. So every birth we go to, we set up a cutting board with a heating pad and throw some blankets and towels over it. Behind that, we have our suture kit. And behind that, we have a bunch of rolled gauze and some hemostatic granules. This is really important if we ever have a mom who just won't stop bleeding. And then this is actually an anti-pneumatic shock garment, which I'll post a picture of what that looks like right here. But that helps in case a mom's vitals are not doing well and we are transporting to the hospital. So that is for stabilizing a mom who maybe is bleeding too much and her vitals don't look great. So that is it in a nutshell. So definitely we carry a lot of equipment with us, as much as we can carry that is reasonable and we think would improve health outcomes. But we really do travel into some areas that sometimes do have really long transfer times. If you live in the metro area, that's usually not a problem, but if we do need to transfer, we usually have enough equipment on hand that we can stabilize people in order to make it to the hospital in time for some additional help to be received. I hope this was informative. Please post some questions down below if you have any other questions, and I hope you have a great day. Bye.